persons, our speakers who are giving us support every day, moral blessings. Kindly, Dr. Swagat, please mute the mic. So, this is our 368th journey. Now, with your blessings, support, contribution, and valuable guidance as resource person, we have been able to achieve this great brainstorming, knowledge sharing journey of Ayush Samriddhi International Webinar Series. I would like to welcome Anil Johri ji. I would like to welcome Vishnu Prasad Sharma ji. I would like to welcome Dr. Swagat. I would like to welcome Dr. Agnihotri ji, Madhu Sharma ji, and Harish Verma ji from Toronto, Canada, and senior dignitary Dr. Rampal Somani ji. सभी का स्वागत है. All are welcome. This platform is yours. No commercial aim, no commercial game. We are only sharing valuable thoughts amongst next gen. Our program is live on YouTube, Ayush Samriddhi YouTube channel. The link is being shared just now to all the audience and experts. Kindly share it to maximum persons to involve them, to communicate them that we are here to support you, because one black spot was there that senior persons are not sharing knowledge to next gen. So Corona has broken this myth. I would like to welcome Madan sir, Professor Madan Thangvelu ji from Cambridge, Dr. Harish Verma ji from Toronto, Canada, Dr. Rampal Somani ji from Jaipur, Agnihotri ji from train at this time reaching BHU, Anil Johri ji from Delhi, Nishanth ji from Calcutta, and Dr. Saurabh recently introduced by Sri Agnihotri ji, very fortunate, Divisional Ayurvedic Officer from Morena, Government of Madhya Pradesh. I am also from Gwalior. I did up to my BSc and BMS first year, I was in Gwalior, and then shifted to Ashtanga Ayurveda College, Indore, and then did my MD in 1989. At present, I am retired by the post of Vice President Imami, and in between, I was the lecturer and reader of Government Ayurvedic College, Rajiv Gandhi Memorial Ayurvedic College, Kakinada. So this is my brief introduction. I would like to request Professor Madan sir. Madan sir, welcome.
Pawanji, namaskar.
Pranam sir, pranam.
Namaskar. Thank you so much for bringing us all together again on this platform. I enjoyed what you've just said, that the sharing of knowledge has been an issue, and partly because we never felt the need for the sharing of knowledge. And this was something, we always say life gets in the way, and we could never feel the importance of sharing this knowledge. And sometimes we take for granted that everybody has this background information. But all of a sudden, through this platform, we have learned how there is a gap in that area of knowledge sharing. And through the series of webinars, now we like to call them conferences rather than webinars, because we have such a large number of distinguished panelists who join us. So a webinar seemed a slightly lighter word for describing this. So we felt it's a knowledge sharing platform, and in these conferences now in excess of 360 and progressing towards the 400. We have we think we have achieved, and the modality is very flat in its structure, in that everybody joins, whoever has time and wish can join, and the platform at the end has a discussion section where we invite everybody on the platform to contribute their thoughts and wishes. Now, today's theme is very special, asthma, and we have distinguished colleagues. Now, before we get the floor started, there is a connection between asthma and inflammation, and there are many clues in the Ayurvedic texts for these, for that connection. Somehow I feel when we look at this whole area in Ayurveda, it's called tamak shwas. Maybe something similar in Siddha medicine. I don't know how homeopathy calls this or Unani calls this, but there are most likely terminologies, and it's an issue that affects a lot of people in a very distressing way. So any help that can be given at that point when people are feeling tense, anxious, and not able to breathe properly is always a welcome contribution. And today is only a very brief introduction to this whole area. When we look at the published literature, there is a lot of information. I will share some on the chat box as we progress through the talks. But we are very fortunate to have colleagues here with us, and Pavanji will introduce them. Before we proceed, just to say that we try and keep to about a 3-hour limit in our program. So we try and close our program by 9 o'clock Indian Standard Time. And I leave it to Pavanji to take care of the next part of our proceedings. Pavanji, namaskar.
Thank you, sir. Thank you very much. I would like to invite Sri Vishnu Prasad Sharma ji for his welcome address.
Good evening. Namaskar to everybody. Respected Professor Modan Thangavelaji, respected Dr. Harish Barmadi, respected Professor V.K. Agnihotriji.
Namaskar.
Namaskar. Respected Dr. Pawan Kumar Sarmadi, eminent speaker, distinguished guests, ladies and gentlemen. Today we have a very important webinar on asthma care and cure. It is the most important subject because in any pathy there is no specific medicine to cure this disease. But Ayurveda, we have a very good medicine to treat such type of cases, and Ayurveda can cure also if it is a 3 years or 5 years old cases. Ayurveda shows very, very good result. So today we have an eminent speaker, Dr. Preena Jane.J, Dr. K. Nishanth, Dr. Saurabh, Purwar. So I welcome all the eminent speaker, distinguished guests, ladies and gentlemen, to this evening webinar. And I declare that webinar is open. And once again, I welcome all of you to this webinar. Namaskar.
Thank you, sir. Thank you, sir. Sir is ex-principal Guwahati Ayurvedic College and president of Vishwa Ayurved Parishad, Assam. So, with the kind permission of Madan Thangvelu, sir, I would like to introduce Dr. Preena Jain, head of the department, professor and head of the Department of Community Medicine, Sri Sai Ram Homeopathy Medical College and Research Center. As our platform is absolutely dedicated to all Ayush therapies, we are here to promote all Ayush therapies together. There is no difference between our traditional pathies, and homeopathy is also amongst us. Welcome, welcome, Dr. Preena. Welcome.
Thank you, sir. Thank you so
Welcome.
much. And I'm very indeed happy to be there in this group. First of all, I thank the Independent Research Ethics Society for giving me this opportunity. And indeed, it's really a new thing for me to be amongst this group. I'm really happy to be there as one of the members here. So myself, I'm Dr. Preena, Jane. I'm currently HOD, Professor, Department of Community Medicine in Sri Saurabh Homeopathic Medical College and Research Center, Chennai, Tamil Nadu. And currently I'm doing my PhD also in Vinayaga Missions University. And to tell about me, I have finished my MD in 2002 in Father Muller's Homeopathic Medical College, Mangalore. And as of now, of 20 years of clinical practice and 20 years in the field of teaching, I'm very happy to have this new venture among the AYUSH group. Thank you, sir. Thank you, one and all, who have gathered here. I think myself, I'm from a homeopathic department, and it's really nice, sir. So today I'll share a little bit of a part of homeopathy and other cases, because we have got a limited time, 2 full cases I have done. So these cases are from my practice and I like to present. So can I share my screen?
Preena ji, please proceed.
Yeah, thank you.
Also, Preena, is it possible to just see if you can improve your audio quality just a little bit? Is there some way to do this?
Now, sir, now can you hear me better?
It's better than before. What did you do?
I just increased the speaker volume.
Oh, okay.
निगम जी कृपया अपना माइक म्यूट रखें। निगम जी कृपया अपना माइक म्यूट रखें। स्पीकर के अलावा सभी का माइक म्यूट रहेगा।
So my screen is visible, sir?
Thank you. We can see it clearly. Thank you.
Yes, sir. Thank you, sir. So, so this is my presentation, a clinical study on bronchial asthma with homeopathy. So again, a warm good evening to one and all. And for all the dignitaries on the dais, I give my sincere thanks and I welcome you all for this. And this today is a day we do it for World Asthma Day. So World Asthma Day was, it was a day which was selected by the WHO so that we can find a better role to cure the bronchial asthma patient, because when somebody catches your throat or somebody closes your nose or somebody pushes us in a room, we know the